Visual impairment. Visual impairment can be broadly categorized into three types: overall blurred vision, central field loss, and peripheral field loss. Overall blurred vision means it affects an individual's ability to perceive sharpness of details due to an alteration in the clarity of the refractive structures. Central field loss, it affects the ability to perceive objects or people in the direct line of vision. It affects the ability to perceive people or objects to the sides. Vision is partially obstructed or non-existent in the affected field. Peripheral field or loss can also result in blurred images in the visual field or in blind spot. Many different conditions can cause vision loss, each affecting sight in different way. We learn the different causes one by one. It is a opacity or cloudiness of the lens. Because of the cataract, light cannot pass through the lens. Hence, vision is affected. Cataracts can be found in one eye or both eyes. Cataracts will cause reduced visual acuity, blurred vision, poor color vision, light sensitivity, or nystagmus. Age is a primary risk for cataract. Gender. Women face a higher risk than men. Family history. Cataracts tend to run in families. The medical conditions such as diabetics and myopia are the reason. Physical injuries to the eye leads to cataract. Overexposure to sunlight. Sunlight increases the risk of cataracts. Risk for people whose job exposes them to sunlight for prolonged periods. Smoking and alcohol use. Smoking a pack of cigarettes a day may double the risk of developing cataracts. Environmental factors such as exposure to light and radiation also responsible for cataract. The pupil looks milky or yellowish. Cloudy vision, double vision, or combination of both. Color vibrancy diminishes. Reading may become difficult over time. Sensitivity to light, difficulty to drive at night. Need for frequent changes in eyeglasses prescriptions. Surgery is the most common treatment for removing cataracts. It happens because of increased pressure in the eye, which builds up due to blockage of normal fluid in the eye. The vision in glaucoma can fluctuate based on the changes in the pressure. Person with glaucoma may have peripheral field loss, poor night vision, and light sensitivity. If not treated, damage to the optic nerve can result. Under medical conditions such as diabetics and high blood pressure, hypothyroidism, physical injury in the eye, extreme nearsightedness, steroids pose a high or lower risk depending on the high doses or for long periods, and a family history of glaucoma. Loss of peripheral vision eventually leads to tunnel vision, the ability to see only the straight ahead. Intense pain in the eyebrow area, blurred vision develops usually in one eye. Sensation feels like the eye will burst. Redness, may see rainbow-like halos around the lights. Sometimes presence of nausea and vomiting. It will affect the children at birth. The symptoms are enlarged eyes, cloudy eyes, often watering and tending to close in the presence of light. Eye drops are the most common treatment. Sometimes laser surgery is needed to either modify the drain or improve the flow of fluid to the drain. In some cases, operative surgery may be necessary to create a new drainage channel for the aqueous fluid to leave the eye. It is a disorder that affects the retina, the light-sensitive lining at the back of the eye where images are focused. The macula area and the retina responsible for short central vision, which is deteriorate, gradually causing blurred vision, difficulty in reading, and finally a blind spot in the central area of vision. There are also juvenile forms which are hereditary. The age. Adults over the age of 75 are affected by AMD. Smoking. Smoking increases an individual's chances for developing AMD. Hereditary. Several genes are believed to be strongly associated with the risk of developing AMD. Gender. Females are more likely to be affected by age-related macular degeneration than males. Prolonged sun exposure. Ultraviolet light damages retinal tissue directly. Diet. The individuals with diets high in fat, cholesterol and sugar and low in antioxidants are more risk to AMD. Obesity. Overweight individuals are more likely to be affected by AMD. BMI greater than 30 is 2.5 times more likely to be affected by AMD. Also, the high blood pressure. Individuals with high blood pressure are more likely to be affected by AMD. Inactivity. Individuals who do not follow a regular exercise routine are more likely to be affected by AMD. No symptoms in early stages of MD. However, an ophthalmologist may be able to detect early signs of the disease. Therefore, it is very important to have a regular eye examination to detect these signs as soon as possible. There is no cure as for dry AMD. In its early stages, wet macular degeneration can be treated with laser surgery. Low vision devices such as magnifying devices, closed circuit television, and large print reading materials are a few of the items help people to maintain a satisfying lifestyle in spite of their vision loss. A hereditary degenerative condition of the retina that results in loss of peripheral vision or tunnel vision. Initially, it starts with difficulty in seeing dimly light settings and progresses to a significant visual impairment. The main risk factor is a family history of RP. It is an inherited disorder. It commonly affects other members of a family also. Begins a rod degeneration with increase in difficulty in night vision, followed by difficulty in seeing periphery. Slowly, progressive constriction of the visual field leads to tunnel vision, eventually ends in blindness. Onset as early childhood to as late as the 40s. There is no permanent cure as such for RP or the retinitis pigmentosa. In the early stages of RP, daily administration of specific amounts of vitamin A under a medical doctor's supervision may slow progress of this disease. Diabetes can cause blood vessels that nourish the retina to leak, develop brush-like branches or enlarge. This can interfere with vision and over time may destroy the retina. Diabetic retinopathy can happen to anyone who has diabetics. spots or dark strings floating in your vision, blurred vision, fluctuating vision, blind spots, poor night vision, impaired color vision, and vision loss. The laser and surgical treatment are available. Low vision devices helps in enhancing the residual functioning. Albinism is an inherited genetic condition that reduces the amount of melanin pigment formed in the skin, hair, and or in eyes. Albinism occurs in all racial and ethnic groups. People with albinism have vision problems that are not correctable with eyeglasses, and many have low vision. The degree of impairment varies with the different types of albinism. Although people with albinism may be considered legally blind with a corrected visual acuity of 20/200 or worse, most of them learn to use their vision in a variety of ways and are able to perform innumerable activities independently. Broadly, there are two types of albinisms: ocular albinism and oculocutaneous albinism. Ocular albinism is less common, involves only the eyes. Oculocutaneous albinism involves the eye, hair, and skin. Albinism is an inherited disorder. A person with albinism has received an abnormal gene from the parents. Most children with albinism are born to parents with normal melanin production and no symptoms of albinism. The treatment aims to ease symptoms and depends on the extent of the disorder. The skin and eyes must be protected from the sun. Sunglasses may relieve photophobia. Avoiding the sun by using sunscreens can reduce sunburn risk. Sunscreen should have a high SPF. Amblyopia is a medical term used when the vision is one of the eye is reduced because the eye and the brain are not working together properly. The eye itself looks normal, but it is not being used normally because the brain is favoring to the other eye. The condition is also sometimes called lazy eye. Positive family history of strabismus, amblyopia, childhood cataract or glaucoma. Strabismus, pediatric cataract or glaucoma, droopy eyelids and eyelids tumor that blocks the pupil. Amblyopia sometimes is treated with glasses, patching or eye drops. In some cases, cataract, glaucoma or lid surgery may be necessary to treat deprivation of the amblyopia. Strabismus is a disorder in which both eyes do not line up in the same direction, so they do not look at the same object at the same time. The condition is more commonly known as crossed eyes. 6 different muscles surround each eye and work as a team and allow both eyes to focus on the same object. When problems develops with eye movement control, an eye may turn in, out, up or down. The eye turning may occur all the time or may appear only when the person is tired, ill or has done a lot of reading or close work. Strabismus is classified by the direction of the eye turns. Inward turning is called esotropia. Outward turning is called exotropia. Upward turning is called hypertrophia. Downward turning is called hypotrophia. Family history. People with patients or siblings who are having strabismus are more likely to develop it. Refractive error. Significant amount of uncorrected farsightedness may develop strabismus. Medical conditions. Conditions such as Down syndrome and cerebral palsy or stroke or head injury are at higher risk for developing strabismus. Includes eyeglasses, prisms, vision therapy, or eye muscle surgery. Damage or degeneration to the optic nerve which carries visual signals to the brain. The nature and extent of the vision loss depends on the amount of damage. Idiopathic medical conditions such as glaucoma, shock, various toxic substances, radiation, trauma, motor vehicle accidents, alcohol, and nutritional imbalance. Dimming of vision and reduction of the field of vision, loss of ability to see fine details, and loss of pupillary reaction to light. Unfortunately, there is no effective treatment for optic atrophy. Low vision devices enable better functioning of the residual vision. Optic nerve hypoplasia is an uncommon defect in which the optic nerve fails to develop normally, leading to blindness. Optic nerve hypoplasia may be associated with other conditions. There is no cure. Rehabilitation services will help the persons function normally. Retinoblastoma is a cancerous tumor of the retina. Progression of retinoblastoma may result in removal of the eye. If one eye is removed, the child will not have depth perception. Age. The children younger than 3 years old are prone to retinoblastoma. Extremely rare in older children. Hereditary. About 40% of retinoblastoma cases result from a gene abnormality inherited from parents. Risk factors for adults include lifestyle-related risks such as diet, body weight, physical activity, and tobacco use. Pupil may appear white or have white spots. Double vision, eyes that do not align, eye pain and redness, poor vision, and differing iris colors in each eye. Laser, cryotherapy, radiation and chemotherapy are available. Stevens-Johnson syndrome is a reaction to a medication or an infection. Often, Stevens-Johnson syndrome begins with flu-like symptoms, followed by a painful red or purplish rash that spreads and blisters. Then, the top layer of the affected skin dies and sheds. It reacts only for few medicines. Infectious conditions. Viral infections, diseases that decrease immunity, example HIV, increases the risk of developing Stevens-Johnson syndrome. Genetics. Carrying a gene called HLA-B12 may make more vulnerable to Stevens-Johnson syndrome. Facial and tongue swelling, itching, a red or purple skin rash that spreads within hour to days. Blisters on skin, especially on mouth, nose and eyes. Several days before the rash develops, may experience fever, sore throat, cough and burning eyes. Medication to reduce dryness. Retinopathy of prematurity, ROP, is a potentially blinding eye disorder that primarily affects premature infants less than 2.5 kg and born before 31 weeks of gestation. It causes abnormal blood vessels to grow in the retina, the layer of nerve tissue in the eye that enables us to see. This growth can cause the retina to detach from back of the eye, leading to blindness. premature birth, brief stop in breathing, heart disease, infection, respiratory distress, slow heart rate, and transfusions. Abnormal eye movements, crossed eyes, severe nearsightedness, and white-looking pupils. Cryotherapy, laser, and surgery are available. Can result in a total blindness in the detached area of the affected eye. It involves the retina separating from the underlying layer. Holes in the retina, eye trauma, infection, blood vessel disturbance are a tumor. Retinal tears can be treated with laser surgery to seal the retina to the back wall of the eye. Temporary or permanent visual impairment caused by the disturbance of the posterior visual pathways and or the occipital lobes of the brain. Children with cortical vision generally have normal functioning eyes, but they have damage to the areas of the brain related to vision. It is a condition that indicates that the visual system of the brain do not consistently understand or interpret what eye sees. The degree of vision impairment can range from severe visual impairment to total blindness. The degree of neurological damage and visual impairment depends upon the time of onset as well as the location of the intensity of the insult. Aphaxia, hypoxia, ixemia, developmental brain defects, head injury, hydrocephalus, drugs and poisons, seizures, metabolic and neurodegenerative diseases, physical abuse. Vision simulation exercise will help in improving vision. Nystagmus is a vision condition in which the eyes make repetitive, uncontrolled movements. These movements often result in reduced vision and depth perception and can affect balance and coordination. This can be horizontal, vertical, circular, or mixed. People with nystagmus might nod and hold their heads in unusual position to compensate for the condition. Turning the head can minimize nystagmus or eyes in a certain position, that is called null point. The null point differs from person to person. Nystagmus is mostly caused by the neurological problem that is present at birth or develops in a early childhood. Acquired nystagmus, which occurs later in life, can be the symptom of another condition or disease such as stroke, multiple sclerosis, or trauma. The other causes of nystagmus includes lack of development of normal eye movement control in early life, albinism, very high refractive error, for example, nearsightedness or astigmatism, congenital cataracts, inflammation of the inner ear, medications such as anti-epilepsy drugs, and central nervous system diseases. Eyeglasses and contact lenses can sometimes improve vision. Using large print books, magnifying devices, and increased lighting can also be helpful. Rarely, surgery is performed to change the position of the muscle that moves the eyes.